Okay, we have just completed the low flow and the medium flow band portions of the calibration. Now we only have the third part, which is the high flow. The high flow band, we're going to be looking at flows greater than 7 liters per minute inspiratory and expiratory. This band is blue. The last one was green. The first one was a pinkish color. We're going to try to make sure that when we use the plunger and push it in and push it out, that the majority of our flow volume loop remains in that blue band. If we do that, we will pass the test. So I'm going to go over to start test. It's going to ask me to make sure that the plunger is completely out, and then I'm going to hit OK. Once the start test goes away, this one's a difficult test. You're going to actually have to practice doing this. As you can tell quickly, I got just barely into there, and you'll notice it said flow rate outside band. Both of these on the left-hand side now, right here, you'll see they have an asterisk, and it says passed, but it has that asterisk. That means I did not reach the majority of my flow inside the appropriate band. So I have to not accept the test, but retest. Make sure the plunger's all the way out. The way I correct that this time is, I've got to be more aggressive and push this plunger in faster and pull it out faster. Both of those passed. I hit accept, go on to the next test. Just going to make sure that the plunger's out. Hit OK. And once the start test goes away, I'll do it again. You can tell my inspiratory portion on this one is a little low. So I'm going to have to retest on that. Test 2. Plunger all the way out. Hit OK. Start test. Both passed. I do it for the third time. Hit accept. Once start test goes away, I'm going to do it again. Okay, now you see that I had 3 tests that passed. All of these are passed. If for some reason you do not see and it's not recording, a lot of times what happens is you'll see the cursor. If you leave your cursor over top of this box here while it's analyzing, it's not going to pull up whether or not it's passed or it failed. Move your cursor out of the way and the words will pop up and let you know if you've passed or not passed. Hit accept. And you can do a print report, and there is my report. Okay, I can do increase the zoom. Do 100%. I apologize for that. You'll notice here. Can you see those? You'll notice that you see my name, you see the syringe side, you see the maneuver type, expiratory and inspiratory. You'll see what the ideal was, what I actually did measured expiratory and then the inspiratory, and then my percent error. The acceptable percent error is plus or minus 3%. You'll notice on the far left-hand side of the screen, we have our low flow, 0 to 0.9 liters per second. Our medium band, 1.6 liters to 4.5 liters per second. And our high flow band at 7 to 12 liters per second. All the maneuvers are done. All of these numbers are within plus or minus 3%. And the outcome of the calibration is I passed. You see the date and time, and that's where I would sign it. And that would go into my logbook. I hope this helped.